Well, we've seen vaccine rollout happening all around Connecticut, and joining us now live to talk about this is Dr. Patrick Cahill, an infectious disease specialist with Hartford HealthCare Medical Group. Doctor, welcome.
Hi, thanks for having me.
Thanks for being here. So the vaccine has been available for about a month now, and there are many people who still are skeptical about it. Are their concerns unfounded?
I hope to dispel any skepticism regarding the vaccine because it is very safe and very effective.
Good. Okay, doctor, we've heard about people concerned about fertility. Women fear infertility and men fear sterilization. Tell us your thoughts on that.
I want to take the opportunity to remind people to check where they're getting their information from and ensure that it is from a reliable source. There's nothing within the constitution of the vaccine or the mechanism by which it affects your immune system that would predict any infertility concerns. Pregnant women were intentionally excluded from the trials that were done based on ethical principles that have been in place for years.
And where do pregnant women stand now? Can they get the virus?
Pregnant women can get both the virus and
the vaccine. Sorry,
yeah,
doctor.
Absolutely. They should talk about it with their doctor, and it is essentially a risk-based assessment on an individual level based on their exposure and likelihood of bad outcomes related to the disease. But I have been recommending to women of childbearing age and those that are breastfeeding and pregnant that it should be a safe intervention.
All right, doctor, let's talk about some of the side effects of the vaccine and which ones require immediate medical attention.
Most of the side effects are relatively mild and include injection site soreness and mild flu-like symptoms. They do recommend that people are observed for anywhere from 15 to 30 minutes following the administration of the vaccine. On the longer end, if those recipients have had a history of severe allergic reactions to not just other vaccines, but even foods or environmental exposures.
All right, let's talk about how long immunity lasts once someone is vaccinated. What are the thoughts today on this?
We are hopeful that it will last for at least several years, but we're so early in the course of this disease and vaccination process that we won't really know that for sure. But optimistically, this will last for at least several years.
All right, and finally, real quick, tell us about your upcoming webinar on the COVID vaccine.
Yes, I'm doing a webinar next Thursday at 5 o'clock so that I can go into a little bit more detail about the vaccines, the trials that have been done so far, and the safety profiles, and give people an opportunity to ask any questions that they may have about it.
All right, more on the web, Hartford HealthCare virtual classes. All right, doctor, thank you so much for being with us. We really appreciate it. And you can also register as, again, hartfordhealthcare.org/virtual classes. Thank you very much, Dr. Patrick Cahill.
Thank you.